The fact is we have big news running underneath. So over the past, since the last broadcast, UnitedHealthcare provided a market update, and it wasn't pretty. You can see it here. Let's just go into UHC. Yeah, and you can see in a month from the high here was $600, and now at 418 it's basically a third, a little bit less than a third, right? There's a problem, obviously. So what ended up happening is a 1 day plunge here, and you can see from 585 to 454, 100 and what, 130 out of five, so more than 20%. Basically, due to the fact that Medicare Advantage underperformed. That line item alone. It tells you, right? 67 million people on Medicare now. How important it is. It told you that because utilization rates on Medicare Advantage and the costs that Medicare Advantage carriers experienced much higher than forecast. A second one occurred. A second one occurred, which is Humana lost the star rating appeal. Now, this doesn't matter to you necessarily, but it does matter because it goes to show about that people don't understand how this stuff actually fits together. Let me move my head out of the way here. So what happens here is that these star ratings, they matter because they change the way that Medicare Advantage carriers get paid. And that money is used to basically create the package of benefits for consumers, for you. So when you get hit here, the amount of money you get in order to create the Medicare Advantage plans declines. This is painful. We'll have to see, and the funny thing here is funny. Not that funny. Funny, not funny. We have a new administrator. We have a new head of the CMS of Medicare. Subject to review before it becomes final tomorrow. Try to be timely over here on Jay's Corner. Be sure to like and subscribe. Leave comments also if you see this live stream after it's done. Tomorrow. So you've got these different things here, and yet at the same time, what we have here, which we have Medicare Advantage funding next year to be higher. And we'll see it here. You'll see it here, which is you're going to see the news. And yes, you'll see dramatically raised payment to Medicare Advantage plans. Medicare Advantage payments plans to, again. And people know here that KFF, Kaiser, head of class in terms of actual facts, right? 7.2% higher. This is a lot higher. A lot higher. Now, the fact is that some of that, very, very, very deep in the weeds, is when the risk adjustment gets harder to get a better star rating, that makes it worse for the carrier. That said, the average carrier, though, will go higher by this 7%. So they are kind of like pushing and pulling against one another. In other words, in 2025, the number of 5-star Medicare Advantage plan dropped precipitously due to the fact that the grading of this has changed. Now, is this a full answer to the controversy? No, I wouldn't say that. And let's see here. you can see over here, if you wanted to see what I would have done and no one's asking me, that's the video here on what I would have done here. Right? And I'm trying to deal with the world that we know, the world that we have, right? Not the world that we hope for. Okay. So you can see I was talking about if Doge called me, if Dr. Oz called me, what would I have done? What would I do? What would I recommend? What they've done here isn't really that. What they've done here is Medicare Advantage higher counters harder grading. So they've used this, it looks like they're going to be balancing these two off. Whether or not that's efficient, I'm not exactly sure. We are going to have ongoing fire. Dr. Oz just accepted the post and was just sworn in the other day. We're going to have headlines for the rest of the year, and here's where we're going to end this, which is the Inflation Reduction Act. So, in the past couple of years, I've been very, very clear that Inflation Reduction Act has dramatically changed healthcare cost planning for everybody, my generation and older. I think that's very clear. Under Medicare, a provision, these are the two provisions of the Inflation Reduction Act, which have most of the headlines and impact. One is that there's a $2,000 cap on out-of-pocket costs for prescription drugs under Part D or Medicare Advantage plans. For newcomers to Medicare, for those people who do not know, that presumes that your medication is covered by the plan that you have. Right? So in other words, if you have a particular prescription and it's uncovered by your Medicare Advantage plan, then you don't get this $2,000 cap. It's only if your specific medication is covered by Medicare Advantage plan or Part D plan that you actually have. Then the $2,000 cap exists. It's still huge, enormously valuable, right? I told a certain set of our clients here, you can get your Medicare guidance. You can info@gh2benefits.com for zero. But you can see it here that for those people, this is a $5,000 a year saving and more easily. The second one is prescription negotiation. I don't think necessarily the prescription negotiation process is really at risk. I do think that the $2,000 cap could be at risk. Now, that's going to be politically difficult, right? It's going to be politically difficult because you're talking about such a large population. That said, the number of people who are actually numerically affected by the $2,000 cap is going to be limited-ish. So as a result, maybe this can slide in the small print. To some, however, it's going to be a problem. The real one is on ACA. The real one's on ACA. I would fully expect that the much greater APTC, Advanced Premium Tax Credit, is all but dead in 2020, at the end of this year. In the latest version, the latest edition of the Substack, it's the second article. And here it is. I would expect the ACA health insurance to be much more in 2026. This is not a heroic prediction. I don't have a crystal ball. There could be a legislative change which would make this dramatically wrong. I doubt it. This is the Washington Post article here, which talks about the degree of cuts on health and human services, $40 billion cut, a third of its discretionary budget. What in here, so I read through the 64-page document, right? So I did this for you, right? Apparently, I don't have anything better to do. The 64-page document says it presumes the end of the higher APTC. Its starting point is there. So the idea that you're going to put it back in, right? It's the starting point, and then there's a $40 billion as part of this $40 billion cut. So if you put it back in order to get a $40 billion cut, that means you have to cut the other by even more. So you can see what my point is just, to me, as you can see it here, that means the only conclusion is it's all but dead. And the thing is dramatic effect. And let's just go to it, because I think that one of the most valuable resources that KFF put is this graphic here. We're going to go to it, right? But if you go to the Substack, to my newsletter, if you go to Jay's Corner, you can go on this and you can click, which we're going to do. So we're going to click, and you can see, based on where you live, the subsidies expire, and which is just like amazing, right? This is an amazing thing. So let's just say, for example, let's just go to somewhere populous. Right? Let's go to Texas. Okay. So you can see it here. In Texas, in this district, 75,000, and I know it's small, but I can't make it much bigger, right? There you go, right? You can see it there. Hopefully you can see it. 75,000 enrollees, 10%, so 7,500 in there. Enrollees with advanced premium tax credit is 73,000 out of 75,000. And you can see what has happened here. For a 40-year-old making $31,000, which is not much, but very not Medicaid eligible, you go from $58 a month to $153, $1,200 a year. To a person that makes $31,000 a year, $1,100 in a calendar year increase of health insurance premium means that this person, if he's Mr. Perfect, he may cancel. And now we have another person uninsured. You can see the second one, which is really where it becomes very dramatic, right? Which is a 60-year-old couple making $82,000 in this district. That silver premium increase is going to go from $581 to $2,491, which is a $1,900 a month difference. $22,800 more expensive for this couple, as we just stated here. Like I said, dramatic effect. I spoke at the beginning about the way the pieces fit. And now you can understand why I spend so much time on healthcare cost planning. Because that number is here. People want to do financial planning. People want to think about how all the numbers fit. I ask them, how much does it cost? And here on Jay's Corner, I'm focused here on this. How much does it cost down here? Why? Because the number is so big and so neglected. Acme Wealth Management blows this number off. They tell you, hey, look, can't do anything about it, etc., etc. I hate Obama. I don't understand health insurance. That's not a good reason for you. It's too big, too important. More energy here. Because guess what? I would defy you to have told me exactly what was going to go on here and get this right. What? You would have gotten this right every tick of the way. More likely, far more successful would have been to control this and plan around this, to understand what this is. And then the ripple effect becomes, okay, now I've got an investment and saving strategy that fits. How much is this going to cost? Now I can make sense of it. It's an important point here, which is everything about the way I work on financial planning. Every element funnels here, starts here. It doesn't change. If anything, it increases the importance of understanding how all of the technicals of this stuff work so that you can drive down taxes or your taxable income. And the reason is still to try to maintain the APTC. Now, here's the issue is that this is of the couple making eight in this example here. It says they make $82,000. What it doesn't talk about is, okay, let's just say that the 60-year-old couple had a taxable income of $40,000, right? Because they had other components here worked out, right? So that the taxable income was lower. They can keep the lion's share of the APTC. And you can see how valuable it is because now all of a sudden, how much does it cost? This orange or whatever this number is here is notably lower. And now you can see an idea of the scope and scale. This is a year. So it shows you the variance of how costly it can be to get it wrong. The coin has two sides, the edge and the other side. The flip side of that coin is how much you can benefit if you get it right. I'm not David Downer, right? We make it fit, but we need to understand the rules about how things fit so that you can fit these numbers to your timeline. That's your bottom line. Thank you so much for everybody. Have a great rest of your weekend. Be sure to like, subscribe, put all your effort. Cass, what? Hold on for a second here. We'll get Cass back up here because no show. I can't even tell you. I can't even tell you. You can see how easy it is. Cass, take us out. We're all done here for today.
Easy like stealing candy from a confused billionaire cap. All right, everybody, this has been Jay's Corner, featuring yours truly, Cass, the C. All soothsayer. If you're breathing smarter right now, you know what to do. Like, comment, subscribe, and blast this to someone who needs a clue. Catch you next time, where we'll be even sharper, louder, and way ahead of whatever slow news cycle you're stuck in.
All right, Kath. Thank you so much, everybody. Have a great rest of your weekend.